Okay, so now we're ready to do the actual button change itself. So I've got everything ready here in the sterile tray. Water to replace once the button has been put in, and a syringe to take the water out before we now remove it. Another syringe to take some sample for the pH strip, which is in there, and our button, which is ready. This is the one thing Maisie doesn't like having done. It hurts when it comes out. It hurts a little bit when it goes back in.
Advice and tips include giving your child something to distract them, singing them, perhaps giving them a toy, making sure you've got everything close to hand, and also making sure you change the button when the CCNs, your community nurses, are working. So preferably don't do it out of hours in case you have any problems.
So, are you ready, Maisie?
Yeah.
Yes. Right, so I'm just going to pop the tray down here. So we don't wear gloves. You may wear gloves. Every person is different. We don't. Okay, so first things first, syringe to remove the water that's currently inside the button. And that's always a good indication that there's pressure in there, because it's actually pushing the water out itself. And then suction out as much as you can. Find somewhere to get rid of the water. Put the syringe on again and just suck back as much as you possibly can to make that as small as possible on the inside. Discard that syringe. Just making it a little bit loose so that it's not attached to the skin. Are you ready, Maisie?
Yeah.
1, 2, 3, coming out. Going to have a wipe over. As you can see, there's food debris and various other different things there. Nice little button. The new one going in. So in, and try and go in as straight as possible. Remove, okay. Remove the introducer. So now what we need to do is put the water into the button. We're going to put the water in. Okay, Maisie? Good girl. I'll keep that syringe just in case we have any issues and need to take the water out again. I'm now going to connect up the extension. Use a clean syringe to test the pH.
We test the pH of stomach contents to check that the button is in the right place. You need to compare the pH reading you just got with the reading that you took before changing the button. The pH number should be the same or more acidic, i.e. a lower number. If it is a higher number, or 5.5 or higher, you must contact your community children's nurse or hospital for review and reinsertion of a button. It is really important that you do not give a feed if this is the case.
To make sure it's the same, again, keep your bottle, test, it's in exactly the right place. Blood and the gel that comes out as you're pushing it in. So it's just an idea to just clean that